Patient came in today with lower back discomfort, started about 2 to 3 months ago. I noticed it when he was driving for work. I thought it was his wallet in his back pocket, took it out, and it's getting progressively worse. He's now training with CrossFit, doing intensive exercise, but notices that when he's driving, after about 30 minutes, it's starting to bother him a lot more. So therefore, he's decided to do something about it. We examined him today. What we found was that the right sacroiliac joint in the lower back was causing the majority of the dysfunction. The left lower lumbar area was compensating for the rotation of the sacroiliac joint, also causing inflammatory responses, pain, and dysfunction when moving. Here you can see the sacroiliac joint. Okay, it is right here. It comprises the ilium and the sacrum. See all these little yellow nerves coming through here? A lot of times what happens with people is that as their sciatic nerve come down through here, you get compression causing sciatic pain or pain down the leg. In this patient, that is not the case. The majority of the discomfort is right here, creating issues in the lower lumbar, in the lower pelvic areas with the lumbar, here we go, with the lumbar rotations on this side. And what's happening is now that when he exercises or when he sits, as he increases the strain in the lower back, then these areas become impinged and they create inflammation and pressure and irritate these nerves, muscles, and joints. Now this is rotated posteriorly or towards us, and it's working in a different plane of motion that is shortening the upper limb or the lower limb here, and that's creating a leg length inequality, which now when he runs is affecting his gait, or exercise affects his gait and creates a lot of issues, pain and inflammatory wise. Also noticing the difference in plane of motion here, where these are rotated back to compensate as they're restricted by this area. Patient's in excellent shape. He should respond very well. We're giving this a 4 to 6 visit treatment plan, about 2 to 3 weeks, 2 times a week, to create repetition in the joints to retrain them, as they have created a memory, muscle memory, joint memory, nerve memory, whatever you want to call it, in that area where they're used to being in that misaligned position. And the muscles have shortened a bit where they shouldn't, or increased in length in other areas where they shouldn't be. So we'll create symmetry and balance in the leg length and the pelvis, as well as the lumbar spine, which will allow optimal function when he works out. The patient also noticed that after we worked on his cervical spine, where he didn't have any issues, he noticed an incredible increase in motion where he didn't even know he had a problem. So he was able to feel lighter in the head, the range of motion in the neck was much improved, he didn't even know he had a problem. So you can see that the lower back issue was creating cervical issues all the way up because of the connectivity, or the synonymousness of the spine, which is important function for our bodies. However, one problem can lead to another problem, can lead to another problem. Therefore, we have to look at the entire spine as we fix it. Treatment will consist of chiropractic adjustments to the restricted areas to realign the joints. Also, we'll be working on the muscles with the adjustment to fast stretch those shortened muscles to get them back to normal length and sensitivity, if you will. Normal proprioception or feedback from those muscles and joints to the brain. We'll also be doing a lot of PT therapy, neuromuscular reeducation, to retrain the muscles, to stretch the muscles, to retrain them basically to normal function. We'll also be doing intersegmental traction to gain mobility in the spine, to work on the overall curvature, increase overall motion in the spine. Also be working with muscle stimulation to reduce muscle tension, pump out inflammation, and we'll be using laser therapy to also heal the tissue at a faster rate. In summary, we'll be treating the patient with chiropractic, physical therapy, and neurological care.